I'm going to be demonstrating a posterior glide stretch. This is an exercise or a mobilization that you would do for a patient who has primary adhesive capsulitis. Studies show that they can have increased range of motion and decreased pain with the posterior glide. So this does not follow normal arthrokinematics of the shoulder, but studies show that they can have an increase of about 31 degrees of external rotations, what the study showed. So I have my patient lying supine, and I'm on her affected side. I'm going to bring her into her full abduction and external range of motion. So you're bringing her into end range. Then I'm going to maintain that position and bring a mid-range lateral glide to the shoulder. Then I'm going to posteriorly press through the glenohumeral joint and maintain that posterior glide stretch for a minute, and then repeat this for about 15 minutes. So it is a long, low-load stretch, mid-range lateral and posterior to end range. As my patient continues to increase that external range of motion, you continue to go to the patient's end range. Then a progression for this would you would bring your patient still into their abduction and end range of external rotation and flexion. Find where their flexion and external rotation end range is. Then you go to the proximal humerus. Again, bring a lateral glide, and I'm maintaining my patient here on the table with my hip, and then I'm doing a posterior glide here at the end of the humerus and pressing through, maintaining that for a minute, and then letting the patient recover, and then again for another minute until the patient has had 15 minutes total of that low load, long stretch for the posterior capsule of, actually the entire capsule. So this is the posterior mobilization stretch for adhesive capsulitis.